I am Dr. Deepa Dewan. I am a Senior Director at Cloudnine Hospital, Golf Course Road, Gurugram. If you have been diagnosed with endometriosis, you've been having very painful periods, you've been having painful intercourse, the doctor has got some tests done, the ultrasound is showing endometriotic cyst, you are having a CA-125 which is somewhere between the range of 35 to 100, and your MRI is also showing some signs of endometriosis. Once the diagnosis is made, a discussion with your doctor regarding the treatment options is a good alternative, a good approach. So once you discuss with your doctor, there are options, surgical as well as medical, for endometriosis management. In the surgical management, the laparoscopy is the answer for this. Laparoscopy is both diagnostic, it's a gold standard for diagnosing endometriosis, and the medical treatment can follow or precede it. If you are in such an age group or the severity of endometriosis does not seem to be much, medical option can also be done. So the whole reason why you have endometriosis or what is happening in endometriosis is that when you bleed outside during a normal menstrual cycle, you're also bleeding into your tummy. That bleeding might be happening on your tube, it might be happening on the ovary, it might be happening on the peritoneum, it could be also happening on the bowel. So because of that, adhesions form, and when you menstruate, you have severe pain. So this is what endometriosis is. So how do we control it? What we simply have to do is to make you stop your menses for some time, because if that stops, you will not have the pain. There will not be any bleeding inside the tummy. So once the bleeding is not happening inside the tummy, your endometriosis will subside. So if you can take the medical treatment, the options would be that the doctor might put you on oral pills, which are estrogen and progesterone combination pills. This all depends on your age. The second option of medical treatment can be a drug called doinogest. You can be prescribed it by itself as a 2 mg or a 4 mg dosage, or there might be an option where a combination pill is given to you cyclically so that you can have your menses as well as treatment of endometriosis simultaneously. The other option can be drugs like GnRH, which would stop your menses completely. So there are medical treatments available. You need to speak to your doctor, discuss the pros and cons, and go in for the treatment. Like I said, that laparoscopy is one of the gold standards for diagnosis of endometriosis. So your clinical history, also the MRI, the ultrasound, the blood test is giving us an indication of endometriosis. None of them will diagnose it completely unless a laparoscope sees the lesions or there's a biopsy of the lesions. So once, if there isn't a surety of your diagnosis, or your endometriosis seems very severe or unable to conceive because of the endometriosis, the doctor might suggest a laparoscopy for you. A laparoscopy done for endometriosis, one, helps us reach a diagnosis. And the same sitting, we are also going to treat it. So we can ablate the spots, the endometriotic spots, we can take out the cyst, which are endometriotic cysts, and those can be sent for examination on a histopath. Once we have this diagnosed, we are very sure about the diagnosis. We've also ablated the spots, so surgically also we've given you some relief. Depending on the further management which has been discussed with your doctor, one option is that if you've been looking at fertility options, you might be guided to conceive quickly, because once you conceive, you will not get your menses for 9 months, and when you don't get your menses, it also treats or leads to treatment of endometriosis. If you do not have plans for conception, the doctor might put you on some medicines to stop your bleeding like GnRH or diagnostic, which will also help you to control the process of endometriosis. So treatments are available. Please do not suffer silently. Get your endometriosis treated.